Great. So, good morning, good afternoon, and good evening, everyone, wherever you are joining us from. Welcome to today's launch event of the first synthesis of the Global SDG Synthesis Coalition's People Pillar. So, on behalf of the People Pillars Co-Chair Agency, UNDP, WFP, UNESCO, UN Women, and UNICEF, I would like to thank you for being here today for the launch of the synthesis titled Social Assistance for the Furthest Behind, what works and how across SDG 1 to 5. We're really happy to have you with us. And of course, I'm really pleased to be opening for a piece of work that represents months of dedicated effort by a dedicated team of researchers and also UN co-chairs. Let me quickly introduce myself. My name is Michele Tarsila. I lead the Humanitarian Effectiveness Evaluation team in the UNICEF Evaluation Office, but I'm also currently serving as a Deputy Director at Interim for the Evaluation Office. And it's a great pleasure to host this launch on behalf of the People Pillars co-chairs. So let me tell you a little bit more about the synthesis before we delve into the details of everybody's presentation. Of course, you will hear more about the global SDG synthesis coalitions in a few minutes. But let me say a few words about this People Pillar synthesis and why this work matters and why it matters today. This is the first synthesis produced under the People Pillar and has been co-chaired and funded by a number of agencies, including UNDP, WFP, UNESCO, UN Women, and UNICEF. And these five agencies, together with a technical advisory group and a wider management group, have overseen the process of the production of this synthesis from scoping until finalization. And the technical synthesis, what we consider the heavy lifting, was done by the Center for Evaluation and Development, C4AD. We are launching of the synthesis at a moment of real pressure. The conflicts, you just have to, watch TV in the morning or listen to the radio are increasing everywhere. And at the same time, the resources are shrinking. We just checked some statistics, some recent statistics just a few days ago. And according to the OECD, April 2026, the global official development assistance has decreased by over 23%, which means that the global development assistance went back to the same level as 2015 when the Agenda 2030 was launched. And it's interesting because in the humanitarian field, that the cuts were even more drastic. It was about 35.8%. But why is a work on protection and social assistance even more important today? I would just give you a pretty interesting statistics, pretty shocking statistics. Almost half of the people living in this world do not have any kind of protection. So 3.8 billion of people around the world do not benefit from any sort of social assistance, according to the ILO World Social Protection Report 2024-2026. And what's really interesting, when we look at the low-income countries, in order to close the gap, it would take about 52.3% of their GDP to make up for, the deprivation of this kind of assistance. So, of course, a work like the one that we're presenting today is even more relevant, because at a time where so many marginalized, the so-called the furthest behind, and not accessing social protection, understanding what works and what doesn't, and avoiding to put money, for example, in interventions or strategies or programmatic approaches that do not work, or rather investing in program approaches that really work and that demonstrated to be effective, has become a sine qua non, like a minimum condition for us to do good development and to do it consistently with our mandates, with our respective mandates. So today we're not just going to learn about the findings of the synthesis, but we're going to have a conversation, a discussion with those among us in our agencies and also outside that have been already using this synthesis. So it's interesting that sometimes in this kind of workshops, we tend to be evaluators talking to evaluators, but in this very case, the findings of the synthesis are going to be the just the entry point for a more strategic, operationally relevant conversations with those people that actually do social assistance in their day-to-day jobs. So I'm delighted to be joined today by an excellent group of colleagues who you will hear from shortly. So let me start by mentioning Judith Friedman, who's a Senior Evaluation Officer and the head for the Country Strategic Plan Evaluations at the World Food Programme. She's also a co-convener of the UNEG Evaluation Synthesis Working Group. And for the sake of the People's Pillar, she's one of the co-leaders of the pillar itself. And Judith will help us to situate the synthesis within the broader work done by the Global SDG Synthesis Coalition. Then we are going to have Dr. Atika Pasha, who is a development economist and a research director, and Joanna Kern, a senior qualitative research and evaluation manager, who work for the Center of Evaluation and Development, C4ED. And so they're going to present the findings of the work of the synthesis itself, which of course they have led for the coalition. After that presentation, we will jump right into the conversations with the so-called users of the synthesis itself. So we have Julia Sivjuc, Head of Capacity Building and Inclusive Growth Unit in the Science Sector from UNESCO. We're also happy to have Rita Shara, who is the team leader for Inclusive Growth at the UNDP Regional Hub in Panama. And last but not least, we have Peter Holtzberg, who's the Chief of School Meals and Social Protection of the World Food Programme. So of course, we're very fortunate to have such a strong panel, and I'm grateful to each of them for having accepted to be part of our panel today. So to set this work in its wider context, let me now hand it over to Judith Friedman, who will tell us more about the Global SDG Synthesis Coalition, its role, and also its ambition. So Judith, over to you. Thank you.
Thanks so much, Michele, for the introduction. I have the privilege of representing my very wonderful coalition colleagues to give you a bit of a background about the Global SDG Synthesis Coalition, which has been behind the People Pillar Synthesis from the beginning. So the SDG Synthesis Coalition is an interagency global initiative which focuses on using evidence to accelerate progress toward the 2030 Agenda. It's built on the premise that we already have a vast body of evaluation evidence across the UN system, and what's needed is to bring it together more effectively and distill it into actionable insights. The coalition, which was first launched in 2022, was spearheaded by the UNDP Independent Evaluation Office and Global Affairs Canada, along with a number of bilateral and multilateral partners, and it was conceived from the outset as a collective effort. It brings together UN evaluation offices, researchers, and partners under a shared leadership with the recognition that the whole of our evidence is much greater than the sum of its parts. So to operationalize this, and I think we can move to the next slide, which I'll speak to, the coalition is structured around the 5 SDG pillars: people, planet, prosperity, peace, and partnership. And each of these pillars has a management group of agencies whose mandates align with the respective goals. For the people pillar, the management group, as Michele intimated, includes UNICEF, UNDP, UN Women, UNESCO, and WFP. Across the management group, we worked collaboratively to identify areas of synergy, both contributing evaluation evidence and drawing on the insights generated. And this process was not only supported by the management group, but also by a technical advisory panel and the analytical work carried out by C4ED, which you'll hear about soon. Across the coalition syntheses, of which so far we've produced 3, on partnership first under SDG 17, on peace, and now this one under the people pillar, there's been a consistent emphasis on understanding what works, how, and why. The aim of these syntheses is to move beyond descriptive reporting and instead generate actionable lessons by examining effectiveness, mechanisms of change, and the contextual conditions shaping development and humanitarian outcomes. This forms the basis for the focus of the People Pillar Synthesis, which is aimed to understand what works and why it works and for whom on social assistance interventions. So we'll hear about that today. Taking an interagency approach through the SDG coalition has allowed us to analyze issues at the policy and system levels to address complex challenges such as resilience, climate action, social protection, and peace, which are questions that no single agency can answer alone. In many ways, the coalition intends to bring on what the UN uniquely offers, which is a long-term country presence, strong normative mandates, and a deep and diverse stock of evaluation evidence across sectors, contexts, and crises. The interagency evaluation-led approach aims to draw out our role as UN evaluation offices as producers, brokers, and users of evidence to contribute to complex and often sensitive global policy debates. Finally, the work is strongly oriented towards supporting policy use and uptake, and we can click across to 2 more slides. So you can see the different outputs. So in addition to the report, which we encourage you to read after this event, the synthesis has produced a policy brief and an evidence gap map. The outputs of the synthesis are intended not only to accelerate progress in the remaining years of the SDGs, but also to inform thinking around the post-2030 development agenda. So with that, I'll stop and hand back to Michele so that we can dive into the substance of the People Pillar synthesis. Over to you, Michele.
Yeah, thank you so much, Judith. So as mentioned at the very beginning, we're now going to hear from the C4ED team from Attica and Ioana, who are going to tell us a little bit more about the scope, the approach, and also, the main findings. So what works, how and why when it comes to social assistance programs, interventions, and approaches at the global level. So Attica and Ioana, over to you. Thank you for being here with us today.
Thank you very much. I don't know if there's a lag in the slides. We are still on the People Pillar management slide. Now we're on the products, next one. I don't know if again, maybe that's a syncing problem. Yes, here we go. Great. Thanks very much. Yes, so when we talk about our synthesis, I give you a small introduction into the scope and the methodology that we used. What we looked into is voucher-based interventions and in-kind transfers in the areas of SDG 1 to SDG 5. What does it mean? We looked into programs that for SDG 1, no poverty, they covered areas like housing, wash infrastructure, household income, non-food consumption, employment, entrepreneurial skills, social protection systems. For SDG 2, zero hunger, this means we looked into programs that tackled food security, food consumption, agricultural production, and livestock production. For SDG 3, health and well-being, we were looking into programs dealing with child health, MNCH, mental health, access to health services, nutrition, dietary diversity, and child labor. For SDG 4, quality education, outcomes the programs we're targeting were access to education, learning outcomes and achievements. And for SDG 5, gender equality, we looked into programs that were tackling reduction of gender gaps, production decisions, control over household resources, intimate partner violence. Next slide. Regarding our synthesis question, we've heard it as with the other syntheses, we looked into what works and for whom. In our case, what voucher and in-kind transfer programs improved outcomes. Across those 5 SDGs and those outcomes we just heard. For those left behind, we were specifically looking for vulnerabilities related to age, gender, and disability. We also looked into how and why it worked, what designs, implementation approaches, and contextual factors influence the performance of these programs. We also looked into system strengthening, how these programs strengthen or struggle to strengthen wider social protection systems. And in the end, we were also looking at what evidence gaps remained. Next slide. With regard to the process, we started screening about 4,000 documents. In the end, we had 250 studies that were included and that we analyzed and we will present findings on. Out of those, about 150 were impact studies, 2/3 evaluation, 1/3 syntheses. About 100 studies were UN process and performance evaluation. All of the programs we evaluated were implemented between 2015 and 2024. We did the analysis using a mixed methods approach, qualitative approach using machine learning, theory-driven coding, including implementation research approaches. And all of that was overseen, as we've heard, by our nice multi-agency coalition that helped us keep on track and make those insights as actionable and as usable as possible. And next slide. And now I hand over for our key findings to my colleague Attika.
Welcome to everyone, and again, happy to be here to present the findings. As Johanna has already mentioned before, we tried to understand what works for the individuals left behind. And again, when we're talking about that, we were trying to cover 4 specific groups, 2 of which we're going to talk about. And I'll just start with age, which is not only looking at children, but adolescents, adults, and then elderly, right? So across the board, what we find is now, however, slightly, so what we find is that age-specific designs work, and they work really well, specifically when you match it to the developmental stage of the child. So when we looked at children between the ages of 0 and 5 or 6, we find consistent results that show that vouchers and in-kind transfers do lead to improvements in nutrition and health outcomes. Unfortunately, what we do also notice in our study that although we observe these very strong results, for example, for under SDG 2 and 3, these become weaker and hard to sort of synthesize as we move into adolescents, which were less well represented, adults, and particularly also the elderly. And again, now our 250 studies were based in low and middle income countries. So the lack of evidence here is indeed a gap that we all need to start filling, and relatively soon, to understand effects, how and why for these groups. Another sort of contextualization that we did want to bring into sort of this finding, and again, this will reflect across many other findings, is sort of humanitarian or conflict proximate settings. And again, studies, whether we look at the ones we see in Mali and Somalia, or even others, we find that when you do not contextualize to the realities of conflict or humanitarian settings, the stabilizing effect of these vouchers and in-kind transfers actually seems to stutter a bit, and therefore, again, contextualization matters. And here you might even lead to sort of decline in outcomes, sort of rather than an improvement that one would like. And then the final finding that is relevant for the age-responsive sort of group of studies, again, we now focus on vouchers, which is sort of less represented. Most of our studies were looking at in-kind transfers. And when looking at vouchers, what we find is that if we look at these approaches, they were particularly effective for sexual and reproductive health care and maternal care outcomes. And they were, and I'll talk a bit more about the sort of mechanism behind it in the coming slides. Next slide, please. Right. So the second group we were also looking at, or the sort of approaches we were trying to see, were whether they were disability responsive. And there we find that basically when we were combining financial aid with other components, such as training for better employment opportunities, improving their access to these opportunities through infrastructural modifications, simultaneously on the supply side, targeting the employer, engaging them to understand and work with people with disabilities, and then finally building on their psychological support, their confidence, actually led to improvements in their employment and well-being as well. And this was, for example, also picked up from a systematic review of already existing studies on disability responsive approaches. Unfortunately, nonetheless, the evidence base here was relatively thin. We only found 4 studies across all SDGs, and actually none within the SDG 4, which is tackling educational outcomes. So again, the gaps that we see on adolescents and to an extent school-going children. This is something that, again, everyone who's an implementer needs to start working on. So, you know, it's not about program implementation, but also understanding whether it works. One study that we could talk about in that case is, for example, eyeglasses vouchers, so health vouchers that were given in rural China and children with myopia, and these vouchers did actually improve uptake. What was noted that even though this program was sort of age and gender responsive in trying to increase uptake amongst girls, that was not an outcome that was found. So there was an increase, but it was not different between boys and girls in the study. Next slide, please. Right, so now I come to sort of one of our strongest findings across these 150 studies that I'm trying to focus the findings on, and that is basically whenever we were looking at a study, any single modality approach was consistently beaten by a approach that integrated one modality with several complementary services. So when you combine your vouchers or your transfers, in-kind transfers with nutrition or with whether that be inputs of agricultural, whether it's training, whether it's behavioral change components, these all led to better outcomes and more improvement compared to a single modality. And the reason why this works is, of course, these integrated programs are not just tackling a financial barrier, but also trying to understand the behavioral mechanisms, sort of the informational constraints, or the structural obstacles that actually hinder financial or sort of in-kind vouchers from being as effective. So they limit the effectiveness, and that's what these integrated programs are now increasingly targeting. So they're enabling adults to, or individuals, sorry, to use these transfers more effectively. Another caveat, again, now this is coming back to sort of the humanitarian emergency context, where we did find studies that did not necessarily have, even within an integrated approach, a successful outcome. And that is because when we design, so the idea is not to go forward with increasing the components, but to understand which components need to target the context in which we are working. So in humanitarian contexts or in conflict settings, it is important that even the components that we increase understands the reality on the ground and adapt to it to improve outcomes. Next slide, please. Right. So this slide focuses heavily on SDG 1, which is related to livelihoods, employment, and income. So sustained income gains were what we're talking about. But again, to remember when this is targeted, also this is a finding which we also see already before the synthesis, that when targeting income gains, particularly for women, and that has consistent improvements also for children in health, nutrition outcomes, right? So when we talk about SDG 1, we're also trying to influence SDGs 2, 3, and 4. So if we were talking about, again, the main finding, one single component is again beaten by integrated livelihood packages. And when I say integrated livelihood packages, it's basically combining skills training with capital or input endowments, providing mentoring, and thereby finding an improvement in employment and earnings. And these effects tend to sustain themselves even after, well beyond the end of the training, right? And how this works is basically the next 3 points. First and foremost, even if I have been trained, I might not have the adequate amount of capital. I might not have the adequate amount of sort of the in-kind resources that might be needed to start up my business. So those startup barriers are addressed if you endow the participants with this capital and in-kind assistance. Simultaneously, while they are trained on the technical side, business coaching, improving their financial literacy, and mentoring them on how to adapt to sort of lean versus sort of more abundant seasons, helps participants manage their income and adapt to challenges. So be financially more capable of managing their own businesses. And then again, ensuring that there's access to the location of the workplace, that there is support to ensure that, okay, the training is adhering to the times where women don't have a lot of housework. These are small program design changes that actually ensure even vulnerable groups are included and actually benefit from this integrated package. Next slide, please. Right. So now I mentioned briefly before the role of vouchers, and here I try to distinguish sort of the mechanisms behind the two. So what we found across the studies is that when we look at vouchers, they were especially effective in addressing the mobility and access barriers, right? They were providing women with cash for the transport to the healthcare centers. They were incentivizing them to do the test for institutional delivery. And so what they were effectively doing was reducing the financial time and time costs, and simultaneously legitimizing women or children being away from the home or them being able to move in public and health spaces, right? So that was often the role that vouchers were able to do. Conversely, if we talk about in-kind transfers, they were often linking sort of goods and services directly to a type of support, right? So food transfers linked to something, or in-kind transfers for agricultural training. And by this linkage and sort of prioritizing certain goods and services, what ended up doing was removing the decision or simplifying the decisions that households have to make to understand what is a better option for them. And thereby this reduction of cognitive burden in this low information setting was how often in-kind transfers were working. So if we look at the global base of evidence, we see, for example, 2 studies in Uganda and Botswana, one using vouchers versus one using in-kind transfers to achieve their outcomes. So again, when we talk about which modality to use, it's again to understand the mechanism behind the modality and thereby try to tackle the outcomes that are most affected by the underlying mechanism behind it. And now I'll hand over to Johanna again, who will introduce the UN process evaluation studies and the next slide onwards. Thank you.
Johanna, you're muted.
Sorry, we also, yes, sorry. So as mentioned, we also looked into contextual barriers and factors influencing implementation and effectiveness. And we found a lot of barriers and drivers, but one of the most prominent barrier that we found was resource constraints. So now you may think, well, that's not novel. We could have thought about that. But what the synthesis gives us is it shows you the scope of how prevalent it really is and how systematic this challenge actually is. We found this in over half of the studies that we examined. The vast majority resource constraints were barriers to implementation, barriers to showing effects. And when we talk about resources, financial resources was also by far the most often mentioned constraint. When we talk about insufficient or poorly structured funding or funding delays, that delayed implementation, that reduced the beneficiary coverage, weakened program performance, and also sustainability. What we could also see is that these resource constraints, these were much more prevalent in conflict settings, almost 3 times as much. But we could see that you have different factors like unpredictable and short-term humanitarian funding, the difficulty in maintaining services during those crises, higher donor funding volatility. All of this leads to that this challenge is much more prominent in fragile states. But it's not all about money. It's not all about quantity. We also saw that there were challenges with regard to the quality of resources and correct usage. So we also had challenges when it related to poorly timed provision of resources. For example, we had an agricultural project where the agricultural assets were delivered before the farmers were capable of planting those. programs where a lack of replacement parts undermined the program achievements. So yeah, we also found evidence on that. On the positive side, there were only a few, but a few evaluations also showed that how resources and innovative resources can drive program performance and outcomes with the right appropriate technological material or investments. For example, in one project, it was mentioned there's a blockchain technology with that they could reach people who didn't have a bank account, for example. So while those were scarce, when it comes to resources, it's not just a negative. It can also facilitate the implementation. Next slide. And lastly, what we also saw that ultimately the evidence on inclusion remained limited despite strong commitments that were shown on a higher level in those programs and those evaluations. So Attica already mentioned it for a few before. What we could see that the research, it often overlooked those subgroups. They focused, when it comes to impact, they often focus on program effects without detailed subgroup analysis. For process and performance evaluations, we could see that those showed high level commitment, but then they lacked insights into those differentiated implementation modalities. And as Attica also alluded to, that the inclusion of subgroups was uneven. All in all, we could see that women and children were, from those vulnerable groups we looked into, were covered the most, while elderly and persons with disabilities were much less prevalent in those evaluations. When we talk about looking into differentiated implementation, we could also see that very prominent factors that research already has established as factors that influence, that affect those subgroups, like cultural norms and intra-household decision dynamics. They were often overlooked in those studies, and that few studies explored those, like how benefits were allocated, or how decision-making power or underlying social norms like influenced program effectiveness or relevance. And overall, one can say that often it felt more like ticking a box versus meaningful understanding of subgroup needs. What I mean here is that we could often see that evaluations showed that, okay, needs assessment done, check, or women's need assessment done, check, a feedback and complaints mechanism set up, check. But what they didn't do is they really looked into those mechanisms and see if and how they are used by vulnerable groups, which we know that they are used differently, that they may have different effects, that they may have different access issues. And that this was, but that those evaluations stayed more on the surface, more of a almost compliance thing to that it was done, but not what the effects of it actually was. And those is like in a nutshell our key findings. Handing back or over to my colleagues.
Yeah, thanks, Johanna. Thanks, Attica. So we now learned about the key findings from the synthesis. So let's try to see how the evidence that has emerged from this endeavor has been used until now by some of our respective agencies' colleagues. They actually work on social assistance. So I would like to go to our panelists and just ask them an introductory question. So, now that we learned about this synthesis, how did the findings resonate with you in terms of the way you design, you develop policies, you allocate resources, and why not? You also work on evaluation. So maybe we could start from Julia from UNESCO, if that's okay with you, Julia. Thanks.
Yes, good afternoon. Thank you very much for having me here from the side of UNESCO. Given how rich the findings are and how short the intervention is, I'll focus on two key takeaways. Those being that the system level change is highly contingent on political stability and government capacities. and that system level change, and importantly, its sustainability, represents a blind spot of our approaches at the moment, with claims of it being made but not necessarily evidenced post-program outcomes. Now, in our view, both of these are absolutely critical. They cut across our mandate, probably because of many mandates here, but also they go to raise some of the meta issues that pertain to system and governance implications of our social assistance interventions. And here I'll make two key points. First point is that integrated social assistance interventions come with extra governance burden. They should not be viewed solely as program innovation, but also as a more demanding delivery model. They're essential. Their effectiveness is discussed throughout the report and evidenced throughout the report, but they do substantially raise the capability requirements on the side of the beneficiary governments. Every additional layer of integration, and our colleagues just presented many of those layers, integration across sectors, integration across levels of government, across types of vulnerability, across delivery mechanisms, including the vouchers and the in-kind transfers, increase the level of complexity governments have to manage, which often is beyond their capacity threshold. Point number two that I would like to make is that it pertains to sustainability and system-wide change again, and the fact that data availability cannot and should not be equated with the use of data post-program by the governments. The report talks very interestingly, in my opinion, about data dependency of the governments on the data that programs and we generate throughout the intervention. But the next question, the step further is, even if that data is available after the program, which is a big if, as we all know, what is the capacity of the government to critically assess and to effectively absorb it in the policy making and planning and delivery on complex multidimensional interventions such as the ones that we're discussing today? The reality is that the integrated social assistance programs become increasingly data intensive, and they're reliant on complex modeling and complex models. And in this context, we posit that government's analytical capacities is becoming not a marginal or technical concern, but a concern and a determinant of the efficiency, sustainability of these programs after we leave and after development partners leave. If these capacities lack, which regretfully they often do, governments increasingly outsource, for lack of a better word, or externalize those analytical functions to development partners such as us or to other providers, including market providers. This is not limited to developing contexts. UNESCO is right now wrapping up a large reform program with the European Commission, supporting 6 EU member states and their governments directly to reduce their over-reliance, as defined by them, and over-dependence on external expertise and external analytical skills, and to build those skills in government through better analytical and consulting services. One of the findings that perhaps resonates with what we're just discussing is that many of these engagements of the governments with external partners tend to replace rather than build government analytical capacities, creating dependency loops that do undermine sustainability of such complex reforms as the ones we're discussing here, but also undermine government strategic autonomy and the ability to remain and stay in the driving seat. Now, our response, as in many development agencies and institutions, is to call for better coordination and to create stronger and better integrated coordination mechanisms. However, our work again shows, including in the EU member states where the administrative capacity is typically much higher than in other contexts, that such coordination mechanisms come with significant and clear and easy to estimate administrative burden that governments may not have the capacity or the resources to carry on after the intervention is completed. So the bottom line and the implication for the future is that perhaps the social assistance programs and the type of interventions we are discussing here should from the get-go ask and estimate the governance and the administrative burden they create in order to assess how feasible it is for the governments to sustain them after the technical assistance is over and after external funding dries up. I will stop here, but not before saying that we have today also here UNESCO colleagues from the IOS, from Internal Oversight Services, who have led this work on UNESCO side, and also education colleagues who will be happy to address any questions that may arise in their area of expertise. Thank you.
Thanks, Julia. So you basically reminded us of how the capacity requirements and the capabilities at the government level should never be assumed. They're not just a peripheral aspect or a dimension or an integrated social assistance program, but they become like an inner core element of whatever we do when we design and then we implement an integrated social assistance program. Thanks also for being very candid about the risk of over-reliance and dependency that could be in evaluative terms to consider an unexpected outcome of the work that we do in many different countries, both developing countries and higher income countries. So thanks so much for your contribution. So maybe we could go to Rita from UNDP in the Panama Hub. So how do the findings of the synthesis resonate with you? Are there findings that are more telling? And how have you guys used, you and your team, what has emerged from the synthesis itself? Thanks, over to you.
Thank you so much, Miguel. And first of all, big congratulations to the colleagues for the report. I think it's very useful for us. First of all, the synthesis makes an important contribution, not only because it tells us what worked, but it's a question that we receive a lot at the Regional Panama Hub. Tell me where it worked, how, and why. When we have, when we have a request from government or country, these are exactly the questions that we get. And first of all, we have seen that the report brings a structural tension and also to do an analysis of what we do, no? The majority of the evaluation says that they have an impact at policy level, legislation level, but when we look at the results, only 6% examined say that those changed very little. The results stay beyond the program cycle. So as Julia said, we have a problem of durability. And the problem of durability or sustainability, it's linked maybe with three gaps that we see over and over. First of all, on the design, we look at the programs in the region and many times we see that this is conceived as a piece of a bigger puzzle and we tend to add a piece to another piece. And this also reflects what also Julia was saying. Many times this is the reflection of the fragmentation at government level, but also the donors, no? This ministry is doing this program of cash transfer, and then another one is doing another one. And then there is a donor whose priority is this program instead of another one. And of course, this fragmentation has an impact. And this impact doesn't have the impact we wanted, the scale we wanted. The second one is financing. Michele, when you open up this webinar saying that half of the population worldwide doesn't have access, is also a point of financing. And in our team, when we look at this and we see, as the report said, that funding gaps appear nearly 43% of evaluation as the top barrier for sustainability, I think that with the sustainable finance, we do have maybe new recipe. We have seen, for instance, in the region, how sovereign bonds sometimes can also be very useful for social assistance and to give another kind of financing to those kind of programs. And then on evaluation, we cannot assess sustainability if we don't measure it. And maybe as UNDP, let's have a reflection of a mea culpa. The fact that we don't have anymore those financing and we have financing gap, I think, yes, is reflected in the number of evaluation we do. I think that the beginning, when I started in UNDP in 2007, we used to do much more evaluation what we do right now. And this is very linked to a finance gap, no? When we offer our contribution to government, maybe this tiny bit of evaluation, so important to learn and avoid the same mistake of the past. We don't give money and maybe we don't give importance anymore. If these gaps are important in a development context, then we have seen that it's very exacerbated in a fragile context, no? And I imagine now how cash transfer will be done in Venezuela, for instance, where to start if, for instance, we didn't do the job before of setting registry, of setting interoperability, no? LAC has been a global laboratory for social assistance innovator. I think that from Colombia to Brazil with Bolsa Familia to Prosper in Mexico, we have been a region where social assistance have been evaluated, and we have for the last 20 years important evaluation and lessons learned. And these are reflected in the results of this document. When we see gender target transfer channel through mothers generate positive spillover in child health. I remember this program we have in Brazil, like Criança Feliz, for instance, linked to Bolsa Familia is one of the examples, no? And when these are linked to nutrition and education and conditionalities tied to school attendance and produce longer term results. But we are seeing that the region is changing. So those programs were made for strategy to reduce poverty that no longer exist. What we are seeing in the region right now? We are seeing a region who is aging very fast. And we are seeing a region now where 80.6 million people aged 60 or older and youth, indigenous, Afro-descendant, and rural population remain underserved. So a little bit, it's a reflection, Michele, of what you were saying at the beginning. And this is in part consequences of our fragmented system that leave a vast middle and cover between contributory social protection for former workers and social assistance for the extreme poor. And I think that this is a reflection we have to do for the future. In a region where we have different crises, more frequent, more and more, where, for instance, having program for adaptive social protection, where we have this anticipatory response, no? We're asking ourselves, if we know that an hurricane is occurring, maybe let's give cash immediately before attending the event. And in a region, we are seeing more and more what the colleague Atika was saying, where we do this match of social assistance plus training for employment, we do identify the most vulnerable, we do protect the most vulnerable, but we always empower them. And I think that this identification, protection, empowerment is a trilogy where we have to look at the future. Maybe to close, the report is clear that sustainability remains a blind spot, and it is exactly where development partners can add the most value. What we are learning, Michele, to answer briefly on your questions, we think that the part of governance is fundamental, but it has to come with institutional infrastructure that makes social protection system last. And we think that the answer stays in social registry, interoperability, digitalization, and data integration, not as a technical exercise, but as a government reform that change how information flow between institutions in order to identify better, protect better, and empower better. In an action that needs to act at central level, but absolutely it has to intervene at local level. And this interoperability makes these programs goes much easily when interoperability can link the central level at the local level, when at the local we can give faster response when this is in place. Thank you so much.
Thanks, Rita. So you basically identify three sets of variables, I would say, dimensions of the social assistance work. There are some ecosystemic issues that dimension. So you talked about the fragmentation, so the donors' funding, but also the lack of funding. And I think that we as UN agencies could play as much advocacy, an advocacy role as much as we can. But it's not directly within our sphere of influence. But then, you remind us that there are some low-hanging fruit, the infrastructure of the governments that we work with. Those are real. We already work with them. This is nothing new. We just have to, promote them. We just have to, work with them to enable, gradual empowerment, a greater, just a strengthening. But then you also, despite your initial presentation that was very much about the dire aspects of what we do, you started like throwing some good, maybe innovative ways of dealing with this. You talked about the innovative financing, and you also talked about how the landscape is changing, not just in terms of ecosystem in general, but also in terms of the typologies of program groups that we have to be serving. And then you, reiterated something that was presented by Joanna and Attica, that, for example, person with disability, but especially elderly people, and in the case of your region, Afro-descendants, indigenous population groups remain underserved. And unfortunately, their numbers are growing and growing. So this is definitely something that we could work on, and that in a way you traced with your diagnostic some of the biggest issues, but at the same time, you provided some possible solutions. And it comes back to the idea of working together and just coordinating with the other agencies to make it happen, to make it more sustainable. So maybe we could give the floor now to Peter for WFP. What can you tell us about the use of the synthesis in your work, how you and your team have been using the findings of the synthesis itself? The floor is all yours. Thanks for being with us today.
Thank you so much, Michele, and echoing also the congratulations on all the hard work that everyone has put into this evaluation, and also just wanted to thank the other panelists. I've been listening with interest to how you have been speaking about this important topic. From our side, from the World Food Programme, as a practitioner also in this area, what struck me most in this synthesis is not how much is new, but how strongly the evidence confirms what many of us see every day in our operations. As mentioned in the intro, we know that governments are facing rising humanitarian needs, tighter fiscal space, and more frequent climate and conflict-related shocks, while at the same time trying to strengthen their national social protection systems. And as an aside, I also want to highlight that the expansion of national systems has really been one of the development successes of the last decade, with I think around 4.7 billion people covered through national systems. And that also includes, if we speak about school meals, an increase of around 80 million only in the last couple of years, to cover the latest figures around 470 million people, or kids in this case, who are now receiving school meals. So we also I also want to make sure that we keep a positive message and acknowledge the momentum of this space. So for me, and I would say for our organization, the synthesis points to three clear messages. The first is that sustainability really starts with program design. We've seen that the evidence shows that food transfers, vouchers, cash, all improve food security, reduce poverty, and help households meet their basic needs. But perhaps the strongest finding is that the greatest impact comes not only from the transfer modality itself, but from how they are designed. Integrated programs consistently outperform standalone interventions, and we've seen that transfers are most effective when they're combined with complementary services, such as nutrition education, school-based support, health services, livelihood opportunities, and when they are delivered through strong national social protection systems rather than parallel mechanisms. And this increasingly reflects how WP works. I want to give an example here. In the Sahel, we have been working together with UNICEF and other partners through a BMZ KFW funded Sahel Social Protection Project that works with governments to strengthen shock, gender, and nutrition responsive social protection systems. So this project combines program delivery with system strengthening, expanding support through national systems where the conditions allow, while maintaining an aligned delivery in insecure areas. And since 2020, it's reached more than 3.4 million people, while at the same time helping to institutionalize social protection as a core pillar of resilience and shock response. I gave the example of school meals earlier as well. It really illustrates this particularly well. The programs that prove most sustainable are those that governments progressively integrate into their own educational and social protection systems and increasingly financed through domestic budgets. As this happens, partners such as ourselves increasingly then shift towards a technical assistance model, focusing on policy support and other types of gap-filling, capacity strengthening. And of course, the same applies to cash and voucher assistance. Where markets are functioning, these modalities continue to provide households greater flexibility, supporting local economies, and strengthen the national delivery system. The second message I wanted to highlight is that sustainability really depends on investing in systems, not only in delivery. Often what we've seen is that the investment with the greatest long-term impact are not the largest ones. Strengthening targeting systems, social registries, payment mechanisms, grievance systems, and crisis response protocols may sometimes receive less attention than direct transfers, but they are what enable governments to respond quickly, efficiently, and at scale when the next crisis arrives. We have an example in Lebanon where for more than a decade, WP along with other partners has worked alongside the government to strengthen the national social protection system, including policy development and beneficiary identification, to targeting grievance mechanisms and overall crisis preparedness. This became very tangible during the conflict escalation there in September 2024, where the National Shock Responsive Social Safety Net was activated within just 2 days, initially supporting more than 60,000 households and expanding to 100,000 in the following weeks. These results were possible because investments had already been made in national systems long before the crisis occurred. And this is exactly the kind of evidence that helps shift policy and investments decisions from funding individual projects towards building national institutions that continue long after external support declines and the attention moves elsewhere. So the synthesis also reminds us here that system strengthening can't be measured simply by whether systems are established. We also need to understand whether they continue functioning after the initial support ends. And that places even greater emphasis on government ownership, institutional capacity, and overall long-term sustainability in both the program design and the evaluation. Finally, the third message is that sustainable programs also need sustainable financing, and this has come up in the other discussions and panelists speaking. But it's worth repeating as well. This synthesis really reminds us that sustainability is not only about mobilizing more resources, it's also about financing programs differently. Predictable, timely, and flexible financing enables governments to maintain services during the shocks and to scale up support when the crises occur. And here, domestic resources will remain the foundation of sustainable social protection, complemented by financing from international financial institutions, climate finance mechanisms, and disaster risk financing instruments. This is another area where I would say that our role is evolving. Increasingly, we're helping governments estimate the costs and returns of social protection investments, identify sustainable financing options, design mechanisms that release this funding before crisis escalates, and where appropriate, support the implementation through these national systems. We see this in a range of countries and regions. Examples include the Gambia, Malawi, and the Philippines, where forecast-based financing and disaster risk financing mechanisms are helping governments respond earlier and more efficiently and effectively to climate shocks. Finally, if you'd like one reflection on the evaluation itself, good evaluations such as this one tell us more than whether programs work. They also help us understand why they worked, under what conditions, and how they can be adapted to different contexts. And they also remind us where the evidence remains weak. And this, unfortunately, and has been highlighted earlier, is on visibility and overall inclusiveness. I think we need to invest more and more learning, and it should be shared that can on this area that can continue to shape overall program design, policy, and financing decisions. To summarize the implications of this synthesis and in response to your question and what this means for WFP, I would say that sustainable food assistance is not achieved by choosing between food, cash, or vouchers. It's achieved by helping governments build social protection systems that can deliver whichever modality is most appropriate, to finance those programs over time and allow them to adapt quickly as people's needs change. Thank you, and back to you, Mikael.
Thanks, Peter. So I guess that your presentation, your contribution builds up on what some of the other colleagues have said. And there are two things that I retain. I think we should stop seeing, social assistance programs are as little gardens where we could play around, a little playground. And then, yes, we have some governments in the background. And yes, maybe we could provide them with some, capacity building. And at some point, by magic, things will happen that will be picked up and sustainably work over time. And, it's very clear that national social assistance programs, integrated social assistance program, more and more has to be understood as primarily government programs. And we as a UN or international organizations, also other NGOs that may be, also represented in some other fora in the future where the findings of the synthesis will be presented, just play an enabling role, but a quality enabling role. And in order for that to happen, unfortunately, you raised again the issue of the quality of funding. But there's something else that you raised, and I think it's an important message to all of us. Of course, we are here today to celebrate this synthesis, but it doesn't mean that now the work stops for the evaluators. Let's not fool ourselves thinking that, okay, 5 years from now, there will be another synthesis, so we're done with the evidence. I think one of the greatest added value of the work that Attica, Joanna, and their team have done is also to identify where we have gaps. And I think some of those gaps have already been identified, namely when it comes to the effectiveness of social assistance programs in humanitarian context, or humanitarian assistance targeting or rather the lack of social assistance programs targeting persons with disabilities. So I'm also happy that Rita was mentioning in her contribution that we need to invest, and maybe we should do a mea culpa at times, within the community of social assistance. There have been a lot of impact evaluations, possibly not as many performance evaluation or quick and dirty evaluations. There's a vast array of products, of evaluation products that could be pursued, that could be thought of. So definitely this is something that motivates the evaluation community, but also you guys as users to promote more the use of evaluation beyond, of course, the synthesis of building upon and expanding on the beautiful work that has been done and that we're here to, of course, to celebrate and to discuss. So now it's a time where I think that everyone had a chance to just to provide, their perspectives on how they're using the work that has been produced. So maybe, we could just turn the floor to our audience. We got over 30 participants with us today. So it would be good to hear from some of our colleagues, who are here with us today. If they have any questions for the panelists, if they would like to share some reflections also building on what has been said until now, share also experiences and how they have somehow used or put in practice some of the findings that were presented today. So this is like an open call to everyone that was here with us. If you could raise your hand and ask a question or share your experience, that would be very much appreciated. So Vijaya, please, welcome.
Yeah, thank you. Thanks to the interesting report and the equally interesting presentations and the panelists' remarks. I just didn't have a chance to read the report, so I would like to know a little bit more on any examples of what worked and why and where. And also, I did not see much in the presentations on private sector because there were points on funds are not sufficient. I think these are some of the issues we already know. Donors do not have enough money. Governments do not have enough money. So sustainability is an issue that's very well understood. I think going forward also will not have enough money to cover the kind of social assistance that's needed. So what was the private sector engagement that the reports are mentioning? How did the agencies come around this? Because they know this challenge, it's been there for a long time. How did they address this challenge? How did they engage with the private sector? What are the financing models that were tried for social protection and social welfare measures? And what worked? Any examples on that would be helpful. Also, if the reports are not covering some of these issues, did the synthesis also look at evidence from outside evaluations and research to bring some lessons for the UN system on financing models or engaging the private sector? Thank you.
Thanks, Vijaya. So maybe for the last part of your question, we could turn the floor to the C4ED team just to understand if, with the understanding that some of the evaluations, including in the synthesis, may have not covered necessarily the private sector or these new modalities of financing. Did your team, Atika and Ioana, go outside and maybe look for studies that covered this? And also, if you could, before leaving the floor to the other panelists, if you have some specific examples, because I know that you sprinkled here and there some examples, so you mentioned countries, but maybe if you could provide with some, just a more concrete examples or specific examples that you're still retaining because it really struck you, or you thought that they were very good and interesting and useful for the analysis. So to you first, over to you, Atika and Ioana, and then let's hear also from the other colleagues to learn more about their experience as well in dealing with the private sector. Yeah, thanks.
Yes, so with regard to engagement of the finance sector, you need to understand that this was not something that we had as a question or a sub-question that we were singling out. It wasn't part of our inclusion criteria for the screening. So maybe, or for sure, there probably are studies that are targeting that. But based on how we designed the synthesis, those studies, we didn't target those studies. But what I can say is that when we examined the barriers and the drivers for implementation, that we couldn't actually, if my memory serves me right, this didn't come up, actually, engagement of the private sector. So this wasn't reported as a facilitator for financing. So what we heard before is it was predominantly always reported as a barrier, but the evidence that we reviewed didn't show innovative designs to make different form of financing a driver for sustainability or for effectiveness. So I think what I can say here is that for sure this is maybe then something that is not sufficiently explored in programming or this type of studies that we reviewed, because yes, for this implementation research that we did on the drivers and the barriers, we only looked at UN evaluations, so we didn't look outside. But if there was something, we would have found it, and we didn't find it. So this is what I can tell you as a gap for program implementation and reporting as part of the evaluations.
Thanks, Joanna. And from you, Attica, would you like to add anything to what Joanna just said?
I was just trying to think of some key examples, I guess, because within the programming element, we didn't find much of that in our studies, right? That was more within the process and program evaluations. So I guess there were a few examples that I did put. One was the iVoucher study from China, which, you were given a voucher to get a subsidy on glasses if you have a sort of a vision disability or reduced vision through myopia necessarily, for example. That did lead to very strong results. Unfortunately, which was interesting that they were targeting girls, but it did not lead to as strong results in girls. Both were affected equally. And again, here sort of this gender bias comes into a picture, which was like a sustained result across the board, right? So a lot of these programs, I was talking about Uganda. What they did was say, here, take a voucher, and then you will use this voucher for going there and coming back. So the transport cost. And what you can do is get your antenatal care through that approach, right? So that's what they did. Or simultaneously, if you took a look at, so again, first I'm concentrating on voucher-based evidence, right? And then there was a similar study that was done, now I'm forgetting the country at this moment, either potentially in Pakistan, where yes, the country doesn't matter, but basically, again, the voucher there was given to mothers for being in the clinic or institutional delivery itself, right? And so again, because they knew they were getting that money for institutional delivery, I'm now thinking somewhere in sub-Saharan Africa, they basically were able to, break out remove the cost element from their view. Now, coming to some other examples, which I think are sort of on this integrated programming, right? So just taking one example of the TMRI from, so again, I'll do two more examples and then I'll try to end it, which is this transfer modality program in Bangladesh. What they did was they looked at just giving people sort of nutritional support, so some kind of in-kind transfer. And then to other set of people, they also gave other mothers, basically, they also gave some training or behavioral change component training on why these nutrients or why this food package is important for their children. And that's where you see impact on the children's outcomes, health and nutrition outcomes. And so that's one study where we clearly see this integrated approach working better than otherwise. And then I guess I did want to mention one nuanced study here. So sort of where in a conflict setting, we've been talking a lot about conflict. It's important to bring it up and maybe of relevance to many others. So the study was done, actually there were 3 studies, and I think they were all done in Mali, I want to say. And all 3 of these studies were looking at this violence or humanitarian emergency. And what they found, one was tackling nutrition. And what they found is like, okay, you're getting a school-based cash transfer, and which means you have to go to school. And then the second was just a food transfer in school. And then one was not tied to the school. You just get a food transfer if you go to the center and pick it up. What was happening in this case, girls' education outcomes improved, the adolescent girls. However, when you look at boys, adolescent boys' educational outcomes, those did not improve. Actually, they even suffered to some extent. There was more attrition from school and so on. And the reasoning for that was in the conflict setting, adolescent boys are the only ones who are able to, with some modicum of safety, move around and acquire this food transfer that is being given at a sort of distance place, right? Secondly, they're the ones who are more likely to earn income. So in that situation, them getting food is a choice versus them getting income and getting sort of goods for the rest of the household. So this is sort of the nuanced result that I also want to present, that I last wanted to present in terms of examples. And I'll stop at that. Thank you.
Thanks. And then maybe, Rita, during your contribution, you were mentioning innovative financing mechanisms, right? So maybe you could talk about your direct experience and illuminate us a little bit with what you've seen that possibly works in this field.
Yeah.
Thanks.
Thank you, Michele. Yeah, I think that a great example is the support that UNDP has given to Honduras Ministry of Finance, where we have issued, the Ministry of Finance have issued the first sustainable sovereign bonds valued for 700 millions with a 10-year term in international capital markets. 91% of the funds will be directed towards a key social initiative, including access to housing, health, education, food security, job creation, and support for SMEs. And the 9% will be invested in environmental projects. So this one, for instance, is a clear example of innovative finance where, as Peter was saying, it's not just about mobilizing money, but it's about leverage and make this happen in a different way, And I think that the sovereign bonds in Honduras is one of those examples. Thank you.
Thanks so much, Rita. So now we have Ana Cristina Daddio from UNESCO, I believe. Please, Ana Cristina, welcome. You're muted, Ana Cristina.
Yeah. First of all, I would like to thank you, the speakers and all of you, because it was very interesting. And I'm coming in with some comments. So I am from the Global Education Monitoring Report. That is the report at UNESCO that monitor SDG 4 progress in the Agenda 2030. And just about the latest report we have published in March 2026, that was about access and equity in education, of course. And we have covered, of course, supply and demand and institutional factors that affect, influence access to education. And so we have covered, of course, many of the policies we are talking about today. In addition, and I think this is really interesting for the discussion we are having about financing, we have developed an index that is called the Equitable Financing Education Index, that is built looking at the coverage, the existence and the volume of different transfers. In particular, we have mapped on the peer profiles that are counter profiles we have developed starting in 2020 on inclusion. We have and they cover legislation and policies on particular topics that are core to SDG 4. But this year they have been focused on financing. And these 5 financing mechanisms are the transfers from the central to subnational governments, transfer to schools, transfers to families and students, that are transfers by Ministry of Education. But also we have, in addition to these 3 types of transfers, we have transfers from other ministries, in particular from social protections, to reach disadvantaged children and students, and school meals. The idea of this index is to see how education and social budgets are used to reach disadvantaged regions, schools, and students to improve equity in education. And these are available, these results are available, and it was a contribution to monitoring SDG thematic indicator 4.5.3, which looks at the existence of a funding mechanism to reallocate educational resources to disadvantaged population. So I think this is really something that matter for the discussion on the people pillars, because it takes a very broad vision on what countries are doing to improve equity on education. So it's relevant also for poverty reduction, of course, and gender equality, because the report covers genders, and we are publishing a gender report focused on access and equity in the next coming weeks. And of course on SDG 4. So and I think the link are shared in the chat right now. So if you have any questions, we will be happy to answer. Thank you.
Thanks, Anna Cristina, and thanks also to Martina, who shared some more information. I think your contribution really reminds us as the synthesis is definitely a monumental piece of built-up evidence over the years, but it's not the only one. We could definitely build on it and look at also the other repository of knowledge of information, such as the Global Monitoring Report that is a flagship publication in UNESCO, to better understand the how and the what, as opposed to necessarily the impact, which the synthesis, of course, is more focusing on. And I'm sure that, if the colleagues could share, even after the workshop, some more publications, recent publications that build upon the synthesis itself, it would be good to put them together so that we have this multiple repository of knowledge, of information, etc. We also have some other colleagues, in the chat that added some of their experiences. There's Colin. Colin, I couldn't figure out the name of your agency from your email address. Could you please introduce yourself and briefly tell us about how you try to measure, the gender dimension of some programs that you evaluated recently?
Yeah, sure. I don't work for a UN agency. I was an individual consultant, but I was told that this event might be of interest given the experience I had on the evaluation I did. I think what we found was there was really a lack of evidence on anything that spoke to human rights, gender, disability, inclusion, and leave no one behind, beyond there being normative commitments in documents. So what we tried to do was develop a plausibility approach to look at, okay, we don't have an end outcome. So it's a bit like if you build a bridge, you don't need to let traffic run across it before you know whether it's going to fall apart or not. You can test certain things to see if those conditions to carry that traffic are there in place. So we took that approach to the program we were looking at. I won't say which one it was yet because it's publishing shortly, but when it's out there, I'll talk more directly about it. But it involved lots of capacity building, training, a theory around knowledge products being used to develop people's capability. So what we did was break down each activity and say, were this to have been successful in achieving this objective, these conditions should have been in place for that to be possible. That example I gave in the chat was around the knowledge products. So it's basically like good practice guides for people. Now, this program was targeted at lots of West African countries with lower capacity capabilities in this area and not very mature practice. So that's why the program's there. So the questions we asked were, was all of that taken into account when these products were created, or were they created from a more academic perspective? And what we found was that they were highly academic. You had to have an advanced university degree to understand the content. The readability scores were way up high, well, low actually, if you look at it that way. So plain English is 60 out of 100. They're coming in at about 15 out of 100, the way they were formatted and structured. So all of the indicators were that any operational person picking up this document would find it hard to use it. So therefore, is it likely that that product was having the effect that's intended? Probably not. So it's that kind of approach that we use, trying to re-engineer backwards how you get from point A to point B.
Yes. Okay, thanks, Colin. And I guess that, just now we're starting using a little bit more of evaluative terminology at the risk of sounding a little bit pedantic and too much insular in our conversation. But I think, that one of the greatest value added of the synthesis itself is that by showing what works, but also what doesn't, by clarifying what are the sine qua non conditions for social assistance on a an integrated social assistance program to be successful, that kind of information and that list of variables, dimensions, etc., could actually be part of this imaginary, theory of change that as evaluators we could start using in the coming years. And anytime now that we're being called on, working more closely with the users of the synthesis, like the colleagues that we just spoken today, towards just a more systematic measurement. So of course we're here to celebrate the synthesis. It's a monumental piece of work. Let's not just stop here. Let's use the synthesis itself as the entry point for more imaginative and systematic and rigorous work and conceptualization work, even of our theories of change for upcoming evaluations of social assistance programs. So before we wrap up, and thank you so much to everybody, of course, for their contributions and their questions, and also their sharing experiences on the chat, I would like to give the floor back to Judith for some concluding remarks, and then I will end with a few words and we wrap up today's event. So thanks so much. Over to you, Judith.
Thank you. And just to reiterate the thanks to everyone for such a rich discussion and for your engagement today. And a huge thanks to our panelists for orienting the findings of the synthesis within the context of some of the practical challenges and successes in UN programming. So I'm sort of thinking about what comes next. So we really hope that the findings and the accompanying outputs will be actively used and championed. We really have work to make them digestible, accessible, and relevant to policymakers and to users. So we hope that they are, and we really welcome feedback as we sort of work to make these more interactive and accessible. So please do reach out with any comments or suggestions as we try to refine the priorities for the people pillar. And looking ahead, we see an important shift from static products like a report to more interactive and accessible ways of engaging with evidence. So within this context, I just want to take this very quick moment to highlight the work of the Evidence Synthesis Infrastructure Collaborative, or ESIC as it's called, which is a growing multidisciplinary community of communities, I think is what we call it, which is committed to using syntheses to answer complex system level questions, to which the SDG Synthesis Coalition serves as a key entry point. So on that, there's been a $126 million investment to ESIC, which was announced last year, which is being used to establish new sectoral and regional evidence synthesis hubs, which are aligned to the SDGs and their pillars. And the coalition is already working closely with these hubs. And together, this positions the coalition as a central connector, bringing evidence, partners, and learning across the system. So that's a little pitch, and there's a lot of work that's being done on that. And so please ask us and contribute to the work there. And I just want to finally warmly thank C4ED for your commitment to this ambitious exercise and for your patience in getting us across the line. I know it hasn't been easy, and a thank you to my SDG Coalition colleagues and to our excellent panelists, and to Michele for moderating this event, and to all of you for joining us today. We really look forward to your further engagement, but I'll leave Michele to give the final word. So a thank you from our side. Over to you, Michele.
Yeah, thanks, Judith. I think that this has been a very informative panel, also for myself, because at some point I got distracted by all the humanitarian crisis happening. So I followed the work up to a certain point. So I was very happy to see the final result. And to me, it was very powerful again that we didn't have an evaluators talk of evaluators talking to evaluators of synthesis specialists, talking to other nerds and data geeks, but we actually got involved at the people that we and the colleagues that we created and we worked on this for, where the people eventually they're closer and closer to the people that we're supposed to be serving in the field. So as you said, I'm glad to see that this is not a static work. You all champions just for being here, ambassadors basically of the synthesis. So spread it around. If you haven't read it all, if you haven't looked at the evidence gap map, etc., just get engaged, and of course get back to the co-conveners and in the group in case you have comments, and please just keep using this synthesis also for other purposes. We talked about the possibility of developing theories of change. If you're commissioning an evaluation, for example, in your respective agency or your social assistants, share this synthesis with your consultants. Make sure that people, either users or other evaluators, become intimately familiar with the content of these very important publications. So again, have a really good rest of your day, afternoon or evening, wherever you're connecting from. And thanks again, and stay tuned for some other events organized by the Global SDG Synthesis Coalition. Thank you so much, and enjoy the rest of your day, afternoon or evening. Bye. Take care. Bye-bye. Thanks to all the panelists as well. Bye. Bye-bye.